artificial intelligence is changing the world and surgery is no exception.
From robotic arms to real-time data analysis, AI is already assisting surgeons in ways we never imagined.
But how far can it go? Will AI replace human hands in the operating room?
Okay, hi and good morning, Dr. Nazura. We are truly grateful for your time. We are aiming to better understand the impact of robotic technologies, their limitation, and how they fit into real surgical setting.
Could you walk us through your journey as a doctor? We are really excited to know what inspired doctor to pursue this job as a oncology, and how we also want to know how has this shaped your perspective on the technology advance in medicine career.
Thank you for having me. I've been in medical life since 2008, starting with general obstetrics and gynecology. But as the year goes on, especially when I come to Malaysia, I feel delivery and babies are a bit too hectic for me, and I feel surgical base is what I want to go and explore. So that's why I come into gynecology, and then I got the privilege to go to Korea, and definitely have the first-hand excellent experience with how they deal with robots on a daily basis. So, and has this shape your perspective on technological advance? I mean, it's always a welcome when you have technology because it overcomes human fatigue, and precision is what we want to look for when we do surgery. Okay. I mean, when we talk about doing surgery, the more meticulous you are, the better outcome for your patient. So I find them very meticulous because they like bloodless surgery, so they don't like blood. Okay, so to the point when even the instruments that they use will be very fine, and movement is not like slashing or bleeding, and then you stop the bleeding. There's no such thing. You see the blood vessel, you stop the blood bleeding first, and then you cut. That extent of precision is what I aspire. Maybe blood loss of 50 mils if even. So it's excellent skills among themselves. It's funny now, when I started to do ONG, I feel I can't see gynecology. They're all dying. They're very sick because they have cancer. So at that point, I feel I cannot deal with it. But for some reason, as I get into the specialty, I feel somehow death is not the end of everything. In fact, some people should die, but they suffer long enough that sometimes you can't offer anything, and the only resolution or relief for them is death. So when and maybe it's just making us realize that life has to end in some ways. Go back to excessive treatment of surgery to the point of just asking, how are you today? So the variation of gynecology is something that excites me. And of course, we like to operate on people, but the more you do the specialty, the more you feel not everyone should be subjected to excessive surgery.
The Hinotori surgical robot from Japan, from what I have doing my research, is robot like Da Vinci system.
Yes.
They use is designed to reduce surgeon fatigue and improve precision to robot articulation.
Yes.
From your perspective, and having doing a lot of procedure for cancer in this department, do you believe we are heading toward a future where AI can actively participate in parts of surgery, such as decision making, suturing, or tissue differentiation without constant human guidance?
Right. As much as you feel robot is doing the surgery, we are still the main operator. But the technology helps in the sense that they give accurate visual field. As in, when you really want to see the blood vessel or some structure that should not be touched, such as ureter, this technology really enhances those surgical anatomy. So I find that very useful compared to using laparoscopy, where you just use maybe a simple monitor where your anatomy may not be as accurate. But having said that, yes, I agree, fatigue is one of the things that we can be a problem of. And when you have the robot holding the camera all the time, there's no more assistant falling apart and feeling like things are going to just be shaky because they're so tired of holding the camera. So that part is completely eliminated, which I find very useful. And even if the surgeon is tired, they're actually operating while sitting down. So whatever the fatigue of certain position that's not suitable because they're looking at the screen and then trying to do their hand movement and operating is pretty much been minimized. But I find the type of cancer, the one that is quite complicated, long, can take the whole day, involves so many teams, can be removal of the womb and then the bladder and the bowel at the back. Sometimes these Korean people are very meticulous. They can just go and chase every single little nodules anywhere in the abdomen. You can take at least, I don't know, easily 5 to 6 hours, and maybe take a break a bit and then come back again and just go on digging. Size it can be big, but if it doesn't attach to anything on the sides, you can take it out in half an hour. But if it's attached to everything, there's bowel there, there's blood vessel close by, that's when things are very messy. When we talk about cancer, within 5 years, we see how many people are still alive. So that's how you say about staging or prognosis or chances of living. But I think the poor one is still the one we call ovarian cancer, where by the time they know the diagnosis, they already stage 3 and 4. So even if they want to do as much as they want, maybe they might live until 1 year. Depends on how bad the organs are involved.
So ovarian,
cannot. But you'll be surprised, you see, in our Malaysian practice, they only operate on cancer or tumor or growth more than 5 centimeter or more. But I've seen in Korea where it's only small ones, and they just say they do a imaging, PET scan, which also can be used, apply AI into it. I think radiology or imaging are moving towards that because they like to see patterns. So sometimes you scroll down the screen and you kind of miss certain area that's inflamed or enlarged or not normal. So I have to check with my friend, but they say radiology might be slightly disturbed because we can proceed AI are coming in. And before we even go to surgery, we already have them extensively scan, do CT, assess them and examine them. So in anticipation that there will be something bad that will happen. So let's say you say bleeding, right? Even with the scan, after CT scan, they will say, oh, this is a vascular tumor. So you can anticipate already. the problem with AI is I don't think you can anticipate that until you actually open the patient's abdomen and see for yourself. At times, if it's too extensive, you may even cancel the surgery. Open, close, because you don't want patient to die on table.
So if someone die on the table, so there's no one who can begin, right?
Okay. And maybe from your perspective, you say, it's fate, right? But for doctors, we're going to be grilled because of it. Because obviously you don't plan properly, so we do not like anything surprise. Even the anesthetist, the one that puts patient to sleep, if they say it's too risky, you should not proceed. If you proceed and patient die, they're gonna say surgeon's fault. We in a neutral position. In a neutral position, of course you say no blame game, right? But Malaysian setting, they kind of will look for people to the point of finger to.
So even though doctor know that your capability for doing that surgery,
Yes.
but at the end sometimes fail. But tak tahu mana silap.
Trust yang boleh believe. Tapi ada tak tahu apa benda tu.
Die. There's going to be something to explain the reason for death. But there's some very unexpected one lah. One patient, I still remember. Patient is quite oldish, 60 something, going for surgery for like maybe womb too big or bleeding. They put her to sleep and then they give antibiotics before the operation. Patient allergic reaction so bad, patient died. Okay, now that kind of unexpected time, of course you cannot do anything lah. You can only apologize to family and say I'm sorry, it's really didn't expect.
Tapi supposedly kalau orang tak allergic antibiotik, patut bagi tahu kan.
Yeah, but if this is your first time taking that medication, how are you supposed to know? Because recently there's one patient who went into the CT scan in US. They give the dye. Patient had allergic reaction on the table, died. Oh, but anyway, you're talking about sudden death, unexpected. You're very confident with the surgery, right? No blame game again, people, human factor. Something that you want to do very harmless, such as putting in an instrument. That instrument could go and poke something that you shouldn't poke, and the blood vessel pop, for example, patient die. So that kind of devastating moments are making a surgeon feel like, oh my God, I should be operating.
Kena suspended tu kalau
By principle, you need to take a break. One complication, mistake is such a painful thing to hear, right? But that's not fair either.
Doctor also is human.
I mean at least mindset from Malaysian citizen.
Yeah. No, actually, it's not just Malaysian citizen. I work in overseas also. They are very much into litigation, you know. So as before you even operate patient, you have to explain everything.
Our session interview come to the end. So thank you so much, Dr. Nazura. We really appreciate that you could spend some time for us to interview you about the AI in the future surgery. We hope all the information and all the info you give to us will give the success to our project, and please wish us best of luck in our
I wish you all the best. Pass with flying colours.
Reflecting on today's interview with Dr. Nur Azura, I realized how much depth and responsibility is required when engaging with a high-level expert. My role was to open and close the session, and thought this might seem like the easier part. I found that the setting the right tone from the start and wrapping things up meaningfully took more thought than I expected. Dr. Nur Azura, calm yet authoritative present, challenged me to maintain professionalism throughout. What really struck me was her perspective on the future of AI in surgery. Even though I didn't ask the most ethical question, I listened carefully as she explained the pronounced role AI might play in healthcare, highlighting both its promise and its current limitation. It made me rethink how we often frame technology as a replacement rather than a tool. Her remarks about clinical intuition and patient trust made me reflect on how empathy and decision making are still deeply human aspects. If I were to improve one thing, it would be my confidence during the closing. I was so focused on getting the words right that I forgot to speak from a place of a real appreciation. Next time, I hope to balance structure and sincerity more naturally.
This interview really pushed me to grow not just as a student but as a communicator. Being the one responsible for asking the main question meant I had to stay alert and ready, especially when we started discussing big topics like AI in surgery and the ethics behind it. Dr. Nur Azura didn't just give a basic answer. She shared honest, layered insight based on her experience in real operating rooms. It made everything feel more real, not just something you read in the articles. One moment that really stuck with me was when she talked about explainable AI and what is important for doctors and patients to understand how decisions are made. Hearing her talk about this in the Malaysian context opened my eyes. It's not just about having advanced technology, it's about trust, culture, and whether people feel safe and supported by the system. I admit there was a point when I wanted to ask a follow-up question about how AI might be used in rural hospitals, but I hesitated. I didn't want to interrupt or stir this topic off course. Looking back, I think that was a missed opportunity, but it also taught me something valuable. Being a good interviewer isn't just about asking prepared questions. It's about being present, listening closely, and knowing when to dig deeper. Next time, I hope to be braver because moments like this interview don't just inform, they inspire, and I want to be ready to make the most of them.
Today's interview with Dr. Nur Azura was a turning point for me. I asked some of the more reflective and ethically complex questions like accountability in AI-assisted surgery, and hearing her thoughtful response made me aware of how intricate the real-world implications are. Her point about shared responsibility between surgeons, manufacturer, and institution made me realize that medicine isn't just about the science, but it also about the systems, law, and ethics. From a communication standpoint, I learned how to manage nervousness. Before asking my first questions, my heart was pounding. But once I focused on listening to Dr. Azura's voice and truly engaging with her ideas, the fear faded. I found myself not just doing the assignment, but really wanting to understand her view. One moment that stuck with me was when she spoke about unexpected complication in surgery. How no AI, no matter how advanced, can fully replicate the split-second decision a human surgeon makes when lives are on the line. It reminded me that being human is not a limitation, but sometimes our greatest asset. This experience strengthened my ability to handle complex dialogue and gave me a clearer picture of how AI might complement rather than threaten future healthcare professionals like us.